Hey, what's up guys? It's Dan again from CryptoCamacho.com, where each day I show you the latest tips, tricks, and the best ways to make money in cryptocurrency. Today guys, I have a very exciting ICO that I want to review for you guys. I want to know your take on this. I think this could be a big breakthrough in the medical community and would love to know your take on this ICO. So what am I talking about, guys? I am talking about an ICO called MetaChain. MetaChain, it claims that they are saving lives on or with the blockchain, the medical big data platform. This is exciting, guys. This is a problem that people, companies, industries have been trying to solve for a very, very long time. Bringing medical records into a centralized repository so that doctors, researchers, patients can see that data and access that data, utilize that data, research using that data in real time by accessing that network. This obviously has been a very, very challenging thing to do with the technology that we have available today. A lot of companies have been trying to tackle this problem, including GE, Microsoft, SAS. A lot of other companies have been trying to tackle this problem because it's such a big and complicated, complex problem. So MetaChain is trying to solve the exact same problem, but by utilizing the blockchain technology. And I think this is actually very, very revolutionary, and I think it's a prime time for an ICO like this to be popping out, because I think blockchain can solve a lot of the problems that haven't been able to be solved before by other companies, by other industries, and by other technologies in general. So let's just kind of go through this ICO step by step. Let's see what it is. Let's go through it, and actually at the end of the video, I'll actually probably show you a little bit on how you can actually buy the ICO tokens during this token sale that they're running right now. So first and foremost, what is MetaChain, right? So MetaChain is attempting to solve that problem that I was just telling you about, to bring medical records onto the blockchain, into a centralized, or in this case, a decentralized distributed network, right? Or database, if you will. And they're going to be doing that by using the Ethereum blockchain, bringing all medical records onto the blockchain to make it possible for patients to access their data, their medical history, their medical records, anywhere, anytime in the world. It'll allow patients to give access to other medical providers to access their data, their own medical history, and so forth and so on, right? You can imagine that'll be very beneficial as you switch doctors, go to specialists, things like that, get tests done, so forth and so on. But it's also going to enable doctors to, and medical professionals to access those records and to very quickly understand your medical history, right? And then thirdly, I think this is a really, really crucial piece of this, is that it's going to enable researchers to look at and see the data in an anonymous way to do research in the medical fields, right? So imagine if this network grows very, very, very large with hundreds of millions of people on the network. Just imagine the type of medical data they'll have available on this blockchain at any point in time, right? That they could then study and kind of cross-correlate with each other to study, diseases across populations, disease control across populations, outbreaks, in different regions of the world and what may have contributed to that, seasonality of different diseases, medical conditions that may have predispositions, or medical conditions that may have developed over time. They'll be able to study these type of things using this data because it'll be accessible within this kind of wide-ranging decentralized network. And of course, it'll only be available with the permission of the patient, right, of that medical information. So that's kind of in a nutshell what MetaChain is. Hopefully that's a decent explanation for you guys. I'd love to know what you think. Let's go through some more of the specifics on the actual website here. It's metachain.online. That's their site. I'll put the link in the show notes here. I definitely recommend you watch this video. Very informative, how they're creating this big data platform. And if you know anything about big data now in the 21st century, in 2018, big data is big business. Big data is very complicated, right? Data is valuable, right? Companies now that own data, that generate large amounts of data, actually have been known to disrupt multiple industries simultaneously. I mean, think of Facebook, think of Google, think of Netflix, think of Yahoo back in the day, right? Think of all of these different, think of Internet of Things companies as well, right? The more data they're getting, Google, the more data they're getting, the more powerful those companies become, because data is very powerful, right? And so MetaChain is trying to, solve the big data problem with medicine, with medical records on the blockchain, guys. Okay, so first and foremost about the ICO, this ICO has been rated very, very highly by a number of agencies that track, rank, and monitor ICOs. You can check these out all right here. You could go to the websites here and check out some more details. But as an example, let me just open up one of these for you, right? Track ICO. That is a platform that does research on ICOs. It ranks ICOs based on a number of different criteria. You can see over here. I'm not going to go and do a review of this website, Track ICO, but I want to let you know that there is additional information about this ICO that you can look up, understand, research, and so forth on all of these different ICO agencies that are reviewing ICOs, right? So check that out. I definitely recommend that. It'll give you a lot of insight not only into this ICO, but into other ICOs as well. So highly, highly recommend that. The founder of MetaChain says MetaChain is revolutionizing medical records and healthcare with blockchain, and I think he's absolutely right. I mean, what they're doing is actually pretty groundbreaking if they can pull this off, and I think blockchain is kind of a prime solution for something like this. It's decentralized, it can be vast and big with millions upon millions of users. It can provide accessibility instantly, right, on the network because it's distributed. We don't have to rely on server connections that may be across the world. It's all on the blockchain, right? So it's highly accessible very quickly. About MetaChain. MetaChain gives patients ownership of their own medical data. MetaChain is a medical big data platform, and it allows patients to store their own data in a secure way and give access to specialists anywhere in the world, regardless of the payer network, right? This is big, and I think this is very big in other countries. In the U.S., not maybe as much of an issue. A lot of the medical providers can, kind of cross-share and cross-distribute medical records already through a number of solutions. Not to say it's perfect, but there are solutions in place for that. But I think this is going to open the doors for other countries to start participating in this and to make those data sets and those sample sizes much bigger, right? So that's kind of one aspect of this. Okay, so some key points here. Take your data anywhere you go. So patients like myself, right, a medical patient can move their medical records anywhere they want. It's common that people, change doctors, they go to specialists, they go to different, companies that have different insurance policies, and so they may have to switch healthcare providers and so forth. So sometimes that's a hassle, moving your medical records kind of all over the place. Sometimes can be a challenge, sometimes can be a hassle, right? Getting multiple x-rays, things like that. They're trying to solve this problem by storing that in the blockchain so you can access it anywhere you go for any provider, right? Pretty cool. Next, keep data safe and anonymized. So the data that you provide as your patient medical records will be anonymized, right? So it won't be public information. That's already happening today. That's already kind of the case. So I think they're smart to follow that protocol. Otherwise, they wouldn't go anywhere. Next, no cost to patients or doctors. So that's very refreshing that patients and doctors will not need to pay for this service at all, right? Monetized by patients opting to let medical scientists and companies use their data for research. So what they're going to do is they're going to generate money for the company to be able to do this by data research, by data scientists that are researching the data. They will likely have to pay fees to access that data, and which in turn makes it free for patients and doctors to actually use a service like this, right? They're projecting that there's a 2 billion potential user base for this type of technology. I mean, there's what, over 7 billion people in the world. So, I mean, 2 billion, that may seem a little bit low. It seems like it should be maybe a little bit higher than that, but I think they're being conservative here. But still, a lot of potential for growth, right? Everybody goes to the doctor. Everybody goes to the dentist. Everybody at some point in time sees a medical provider at some point in time in their life, right? So very big market size, which I think is, again, very promising. $150 billion patients worth of problems solved. Not sure how they got that, but I think that's okay. I'll take their word on that. 14,400 times faster transaction speed. And I think what they're saying here is that the ability to access medical records, across the world, it varies in terms of speed. For researchers and doctors to access that information, it varies in speed, right? And they're saying that they're going to accelerate the accessibility of those records by 14,000 times, right? That's a pretty bold claim, but I believe it, right? If you think about some of the remote areas in the world, it's probably very difficult to get medical records, right, between doctors or among doctors, right? Okay, so the solution and the problem is fairly well spelled out right here. So the problem first, that U.S. big pharma spends $157 billion a year on research. Second, medical errors are now the third largest cause of death in the U.S., costing $1 trillion in the U.S. alone. So that's kind of a side issue here that they're solving. Aside from, letting patients store their data on the blockchain, letting doctors access that data on the blockchain, they're actually solving a very big medical research problem, which is outlined right here, right? So the data solution to this problem is population-based de-identified patient data, which has already produced advances against the World Health Organization, top 10 diseases including diabetes and heart failure. Population data lets researchers tackle the big issues in medicine. And I've already talked about that a little bit, right? I mean, medical research, data, science in the medical field is very, very big business, right? It's how big pharmaceutical companies make drugs. It's how they make their next drugs. It's how they decide on what drugs to make by doing research studies that are being, kind of outlined right here. Very big, very, very big business. If you think of any type of pharmaceutical drug that has gone to the market recently, at least in the US, it takes years and years and sometimes decades to approve different drugs, different medical procedures, so forth and so on through the FDA and other organizations. It takes a very, very long time to do that because they have to provide a lot of evidence of research, of testing and trials. And I think MetaChain will help accelerate that by providing data and finding correlational data in the data sets that may help researchers accelerate that overall process. So what does that mean? That means, drugs come faster to market. That means, experimental treatments are quicker to be used, quicker to be tested, which ultimately translates into more lives being saved, more people being treated for diseases that they may have not been treated for in the past. So I think that's overall very, very cool, very altruistic, very, very good cause in and of itself, right? Okay, let's keep going. What MetaChain offers. Using blockchain technology, MetaChain will promote these research breakthroughs. Okay, good. Sharing medical data. By patients opting in and sharing their medical data, anonymously, of course, they will be able to help people who are suffering from similar health issues, right? So if they get a big sample size of data, of a certain number of people that are affected by an illness or disease, they could then isolate down, where the disease outbreak started, where it's progressing, what the demographics and psychographics and health is of the people that are affected by that disease. They can study that. And they could correlate and study all these things together to make breakthroughs a lot quicker, right? And that's kind of what I was saying just a moment ago. Additionally, sharing medical data will streamline the process of finding cures to the world's top diseases or worst diseases, right? Okay, so let's quickly, before we go into the actual token benefits, let's go into the white paper very quickly here. Here's their white paper here. It's fairly extensive, as you can see. You could go and read through this yourself, but it is very, very extensive, which makes me know that they've thought this through very extensively, which I think you would need to for a company like this. This is a big problem to solve. It's a complicated problem to solve. But as you read through the white paper here, it's very, very interesting how they're approaching the problem using blockchain technology. And they're working with, as their founder, they're working with Mark Baker, who's an Oxford PhD, cancer scientist, and big data specialist. This guy couldn't be a better person for the job to be building on a platform like this. I mean, this guy is just kind of an expert in many, many fields, many areas, right? And that always blows my mind how these people are so damn good at multiple fields, right? But anyway, that makes me confident that this is not just kind of some one-off project that they're trying to throw together. It's a very well thought out project that has been in the works for a very, very long time, right? By people like Mark Baker, who are medical professionals, big data specialists, data scientists, things like that, right? Okay, so the abstract claims or says, MetaChain is a medical big data platform. Our proposed system allows patients to store their own data off-chain in an appropriate geographic domain and give access to doctors and specialists anywhere, regardless of the payer network or EMR used. That's very important. Patients, doctors, and hospitals can put data into a compliant cloud, which becomes part of the MetaChain ecosystem, and the blockchain stores pointers and rules on the usage of anonymity, while the data itself is stored off-chain in a compliant cloud, right? Patients can then access their data anytime that they want, as well as doctors and hospitals can access parts of the data or all of the data as provided by the patient, right? Then researchers and pharmaceutical companies can access the data as big data in fully anonymized form. It is monetized by the ability to voluntarily give anonymized access to untampered data to pharmaceutical companies, researchers, and insurers. Potentially, it may also be used for prescription management. So, and this piece is important too. Its unique architecture allows fast access to small downloads to make it practical for everyday medical use. The protocol is based on smart cards or the Ethereum blockchain, and it goes into some tech terms right here, which I'm not going to get into. But that's the key, right? Very quick and highly accessible environment for anywhere in the world. That's the key here, and I think that's what blockchain is enabling and allowing. Not only that, but it's also securing and anonymizing the data stronger and more securely than anybody else, anywhere else has been able to do before, right? That's one of the revolutions of blockchain itself, right? As we go down, you're going to be able to see all the table of contents in this white paper. Again, I'm not going to get into all of this right now, but you can get into it. I think it's very, very good the way they've written this up. You know, the benefits, the description, the context, all very well thought out. And, you know, the market size here, just going back to that a little bit, the average cost of developing a new drug is $2.6 billion. U.S. taken over 106 samples in 10 companies. The annual development budget in the U.S. is $157 billion per year. Mark Baker, who's the founder, has firsthand experience in this sector, doing data analysis, doing research on cancer patients, so forth and so on. And so I think the market size is phenomenal, right? For a project like this, you definitely want to look for a big market size, really, for any ICO. And the market size here is astronomical. It's huge, right? And everybody needs to go to the doctor. So I think that's kind of a no-brainer in and of itself. So that's all I'm going to cover on the white paper itself. But I do want to show you that they have a working MVP product, right, for Metachain. If you go to mvp.metachain.online, you can see their MVP product here. I haven't actually logged in or signed up for an account on here, so I can't log in for you, but you could sign up if you want to check it out. You know, you have new patient registration, you have calculators on different things, so forth and so on. And as you log in, I'm guessing, and I probably may do that at a later point in time, but if you log in, you'll be able to see their MVP platform, how they're developing it out, and you can look on their roadmap to see how they are going to continue to develop that out, right? Okay, so now let's get into the ICO benefits for token holders and why somebody would want to participate in this token, right? So the benefits to token holders is that Metachain utility tokens, MCUs, represent the value of arbitrary patient data blocks, right? So the tokens themselves represent, you know, some of the patient data blocks that'll be stored on the blockchain, right? So if you access or if you hold these MCU tokens, they're going to be worth money because they will contain data that's stored on that actual blockchain. So more on that in a minute here. Okay, so other benefits here: institutional medical data services, including diagnosis, you can use your MCU tokens for. You could use your MCU tokens for medical research and data services. Any and all additional future benefit business transactions on the Metachain platform. Personal medical data services, storage and transfer, MCU discounts, research program voting, and get a chance to determine the focus of future research. That's pretty cool in and of itself. Not sure how that's going to work, but I think it's a pretty cool concept. They've been featured a lot in the news. This company is based in the UK, so you're going to see some UK news outlets here showcasing it. The founder is very connected with a lot of different medical institutions in the world, right? Because he's a doctor, he's a cancer doctor, he's a cancer researcher, right? So he has access to a number of medical professionals across a variety of world-class medical institutions. Harvard Medical Center, UCLA, NHS, University of Cambridge, University of Oxford. These are very big, well-known institutions that have a lot of skin in the game. And so the fact that they're partnering with those companies makes me very, very bullish on this ICO. Their roadmap here, it kind of goes through and shows you how they're researching it, their analysis, and how they're going to open it up. I wish it showed a little bit more on the roadmap, but it doesn't. Maybe later on they will show a little bit more. Excuse me. All right, if you look at the team, I'm not going to go through the team, but I have talked about the founder a bit. Very, very well respected fellow. Very knowledgeable in this field of cancer research, of medical research, of big data analysis, and so forth. The team is robust. You can look through. They have a lot of folks on their team, so obviously I'm not going to go through all of them, but a lot of talent there. A lot of advisors as well. I think that's very, very important as well. Even have advisors on the ICO space. Very interesting that one of their advisors is Mike from ICO Box. I like that. That's pretty cool. Okay. So keep going through this. I'm not going to get into the FAQs. You can look through that yourself. I've already really talked through a lot of these FAQs. What I really want to do now is show you how to actually buy some of the tokens themselves. So let's jump over to token sale. If you click on token sale, you're going to get a form to sign up. I've already signed up, so you can see that I already have an account. I haven't actually put in information here. I wanted to walk through that with you guys. So here's the platform as you sign up. Here's how you go and make a purchase of MCU tokens. If you can see here, your tokens will be held right here after you make a purchase, and I'll show you this in a minute, but your tokens will show up here. The token price is $1. So for one MCU, it's $1. That does seem a little bit high, but I think with the potential of this ICO, I don't think that's actually too high. I would expect it to be maybe a little bit lower, but given the market size here of this project, I think $1 is actually quite conservative. I think in the long run, not in the short term, but in the long run, the dollar value is going to be very, very low. This is going to go far beyond $1 in the future to come. But again, it's not a short-term project. It's a longer-term project. So, you know, it's going to take a year, 2 years to build it out. But the price is definitely going to go up above $1. I'm not a financial advisor. Ask your financial advisor or CPA for advice. I'm not giving you financial advice here. This is just my personal opinion, but that is what I think. All right, so to buy MCU tokens, you have to decide how many you're going to buy. In this case, I'm just showing you a demo, so I'm going to buy 10 MCU tokens. I may buy more at a later time. I need to do a little bit more reading on the white paper itself. I need to do a little bit more research on the price and market cap expectations itself. But I do want to show you how to purchase this, right? So to purchase, you just put in the number of tokens that you're going to buy, right? And then it'll calculate the total number of tokens you're going to get. And that's all represented here. You need to make a deposit. You need to enter your Ethereum wallet into your profile, which I'm going to do right now. Here's my Ethereum wallet. I'm going to copy that. I'm going to go into my profile right here. I'm going to put my Ethereum wallet in there, and then I am going to save my changes, and that should allow me to go and buy. All right. If you want, you can enable two-factor authentication. I'm not going to do that at the moment. I'll do that a little later on. I just want to get through this video so you can see how to buy. But to make it more secure, obviously you want to enable two-factor authentication. Now, go back to your dashboard and let's actually buy some MCU tokens, all right? So good. So now we're all good, right? I'm going to make a deposit in Ethereum tokens here. Okay, so I got to get my payment address, get payment address for Ethereum. So all I did was click Ethereum, get payment address, and this is the address you want to send your Ethereum or your cryptocurrency to, right? And that will change depending on if you're funding this with Bitcoin, Litecoin, Bitcoin Cash, or whatever. But I'm funding it with Ethereum, so this is my Ethereum address right here. So I'm going to go ahead and open up. First, give me a sec. I'm going to pause this video real quick. All right, so what I'm going to do is I'm going to copy this Ethereum address right here that I need to send to. I am going to open my Ether wallet, which is right here. I'm going to paste in the address that they gave me into my address right here. I am not going to send my entire balance. I have about $100 in here right now. I'm not going to send that entire balance right now. I'm going to send about 1/10 of that. So give me 1 sec. I need to calculate what that actually is. All right, so I'm going to send about $10, maybe a little bit more. I'm going to beef that up just a little bit to 5 here. And I'm going to put my gas limit at like 90,000. That'll ensure that it goes through. So I'm going to make this a little bit higher actually to make sure I have enough funds to cover it. So now that I've done that, I'm going to go ahead and make my first deposit. So what I do, as it's saying it says right here, right? Please make sure to deposit equal amounts. The funds will appear in your account wallets only after your cryptocurrency transaction gets 6 confirmations. You will receive an email about your successful deposit. Please note that deposit funds, blah, 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 blah. All right, so now I'm at my Ethereum wallet right here. I'm going to go ahead and say generate transaction, which it's asking me to do that. I'm going to send it. I'm going to confirm it. Yes, I am sure. And boom, there it is. It's been broadcast. Now my payment has been sent to the MetaChain blockchain, and I will wait for those 6 confirmations to get my MCU tokens, right? So that's really it, guys. All right, so now I will wait for those deposits to come through here on the platform, and then I will be able to, have my MCU tokens. That's really about it, guys. Hopefully that was helpful for you. I'm very interested in this site. I'm very interested on how MetaChain is going to perform. Would love to know your thoughts on MetaChain. Would love to know if you guys think it has potential or not, if there's other companies that are doing something similar. But I truly think this is a revolutionary idea, a revolutionary project, and I think it could really change a lot of lives if it effectively, plays out the way they want it to. I think there's a lot of potential here for a very, very good cause, which is why I'm bullish on MetaChain. Would love to know what you guys think. Would love to hear back in a year to see how this all turns out. If you haven't subscribed to my YouTube channel, please click on that little red button right below this video. I'm Dan again from CryptoCamacho.com. Please leave me comments and let me know what you think of this, and I will be forever grateful. Thanks for watching, guys, and I'll talk to you next time.